The COVID-19 virus hit home in the Northshire, beginning apparently on the weekend of July 11th and 12th, when a handful of positive cases were identified, which expanded to about 35 or so by Monday, July 13th, with infections centered both in the Londonderry area and in Manchester. This outbreak led the Southwestern Vermont Medical Center to host a drive-by test site at the Riley Rink at Hunter Park in Manchester on Wednesday, July 15th, and a second one to be held on Thursday, July 16th. About 400 tests were administered on Wednesday between 9 a.m. and 3 p.m., which is about the same number the medical center usually does in a week. The medical center performs these tests regularly at its main hospital center in Bennington, although people wanting the test there need to register in advance, where the one in Manchester this week was first come, first served, with no advance registration needed. Depending on demand, the hospital may continue offering the tests in the future, possibly at its Northshire campus clinic. There are at least two kinds of tests for the COVID virus, one known as an antigen test and the other referred to as a PCR test. Dr. Trey Dobson, SVMC's Chief Medical Officer, explained the difference to us.
Well, you've probably heard there's multiple types of tests right now, but this type of test is the one that's approved by the state. It's called a PCR test, and the way the specimen is collected is with a swab that goes way back into the nose. So not the front part of the nose like you may have for an influenza test, but way back. And that's why it is slightly uncomfortable, but it's important because we need to catch part of the virus, which we know in that distance in the nose is detectable. Right. Well, the antigen test is quicker to perform, and the results are available in 15 to 20 minutes. There's multiple different manufacturers who manufacture an antigen test, and we use antigen tests with many other diseases. The problem is that it has to be honed in, the test itself, and right now the sensitivity is not where we want it to be. In other words, there's too many false negatives with people being tested and turning out negative when in fact they actually have the disease. The PCR test is much more sensitive in that regard. Now, I do hope, and I think most everyone does, that these rapid tests will evolve, perhaps even over the next 3 to 4 months, and be available ubiquitous. I tell you, my goal is that you don't need a doctor's order and that you can get the test done at home. That's the way we can get on top of this pandemic. That's right. Our limiting factor right now, Andrew, is going to be supply of the specimen collection equipment. You might have read many times in the media where the testing equipment is not always available. Today, I will tell you, this morning we brought out 200 tests. We're clearly going to run out of those in a couple of hours. We are trying to contact the state and to get more available, at least by this evening, if not by noon today, so we can keep functioning. If we have to shut down today, I just hope people will be patient and understanding that we're doing the best we can, and we will open right back up as soon as we get more of this testing material.
When the testing opened at 9 a.m. on July 15th at Riley Rink, there was already a long line of cars waiting. The tests will be evaluated as quickly as possible, said Leslie Keefe, SVMC's Vice President of Corporate Development, who is on hand to help out.
The anticipated turnaround time on the test, is that like a week
24
or so?
to 48 hours typically. Could be up to 72, but we say within 24 to 48.
And they'll be tested down at the hospital?
Oh, we've been testing since March. Yes, drive-up testing.
Okay, so the actual tests will be run at the hospital?
We run them, but then we send them to UVM for the results. A lot of capacity. We brought 200 tests today. We will have more if we need it. And we can do pediatric testing as well here today.
And how quickly was the hospital able to ramp up this event here?
Within 24 hours we did it. Actually, it was less than 24 hours. It was yesterday afternoon. We had held incident command at 9 a.m. yesterday morning. And by the afternoon, the Riley Rink, John Larson, John O'Keefe, the town manager, the chief of police, everyone met with our team here, and this was developed.
And you're prepared to stay here for several days?
For as many days as
everyone's
as
got
needed.
a test
Yes.
so they want one?
Yes.
And anyone can show up? It's
Anybody, yes.
not just from around the area?
No, we have a series of questions and informational sheets that we're asking people if they were exposed. The typical wait time is 7 days for symptoms to progress. That's why they say if you've been exposed, wait 7 days and then get tested. Because if you're tested too early, it could come back negative, but you could still, have symptoms later on. So it's that 7-day wait period that's so critical before testing, if you've been exposed.
Involve you in another project.
Don Penji of Manchester was one of those waiting in line, and he told us why he decided to swing by and get a test.
Well, just wanted to be sure I was safe and that my family would stay safe.
Did you have any concerns you might have been exposed to?
I contact a lot of people throughout the day and work, so I thought it was a good idea to try it.
A pop-up test site was also in place up in Londonderry at the Floodbrook School, conducted by the state's Department of Health. Traffic seemed a little less busy there that morning, although there had already been pop-up tests offered earlier at the school, and more are planned to be administered at the Grace Cottage Hospital in nearby Townsend. We had a chance to talk with Dana Zazinski, the Director of Student Services at Floodbrook School, who had just gotten her test.
Yes.
Hi.
What was it like?
It was really easy. It didn't take more than 10 seconds to check in. And then you sit in a chair, take your mask off your nose, hold your head up, close your eyes for about 15 seconds, your eyes water, and then they say, you're done. And it was easy, and I guess I'll get results within 4 days.
Is this the first time you've been through this experience?
It is the first time, and hopefully the last. But it was really easy. If you have to get it done, it's nothing to be fearful about.
Word of the outbreak had emerged earlier for the Manchester Medical Center, which had conducted the antigen tests and started seeing more positive identifications of COVID beginning on July 1st and escalating the following weekend. By Wednesday, July 15th, they had seen 58 positive tests, which are considered presumptive positives by the State Health Department, which likes to have a confirmation by a PCR test before confirming a new infection. The positive antigen test is usually reliable when it comes to identifying an infection, but the State Health Department has concerns about false negatives. In other words, they don't consider the antigen test is totally reliable when it comes to ensuring a patient does not have the coronavirus. Doctors Janelle Kittredge and John Mallard of Manchester Urgent Care discussed that point and more at a press conference held Wednesday afternoon.
Using our antigen, that was on July 1st, so that was a 1. And for the next 9 days, we really didn't see any positives. We averaged anywhere between 25 and 35 tests per day, and with all those tests, they were negative. On July 10th, we had another positive, and on that day we tested 17. So if you look at it, it's really only it's a 5.8%. And that's what we call right now, we kind of say when the wave started, right? So you think of it as July 10th is when we started to see the wave. On the 11th, we had 3 positives, and we had 36 people that were tested. On the 12th, we had 26 positives, and we had 76 tested. And on the 13th, 7 positives, 74 tested, so we're kind of ramping up on the amount we were able to test in one day. And on the 14th, we had 21 positives and 64 tested. And that's at 33%, so that's a pretty significant number of the population. So since we began testing, our first time that we started to test was actually on 5/20 of this year. And we have tested right now, we are close to 800 tests that have been run. Of those 800 tests, we're right around 59 positive at this particular point. So if you look at that across the entire board, that's right around 8% since we've started testing on 5/20. But since the wave really began, we're right around 23% are positive. So out of every 100 people right now, we're seeing about 33 are positive. And remember, we're testing patients that have come in, they've been positive. They then are bringing in their loved ones, their close network of friends, people that they're reaching out to say, hey, I'm positive, you need to go get tested. So, these numbers could be higher than the overall general population, because it is a group of people that's talking amongst themselves that are having their friends and loved ones come in and get tested.
Okay. So now there's been question about the type of testing that we are utilizing. When it comes to the coronavirus, there are 3 types of tests that we are utilizing for this particular situation. We have an antigen test. We have a PCR, which means polymerase chain reaction test, and we have an antibody test. The antigen test is the rapid that we use here. We get a 15-minute turnaround time. It's a swab in the nasal cavity. The nasopharyngeal test is the PCR, That's the one that goes to the State Department, UVM Medical Center lab, etc. That's also a deeper, what we call a nasopharyngeal swab. Then we have an antibody test, which is a blood test. So there's a lot of confusion as to what those are and what they do. So in an acute infection, right now during the acute phase of this pandemic, we want to know, are you actively infected? That would be with the antigen test and the PCR. Are you actively carrying virus? Antibody test is helpful down the road. Have you become infected at some point in time? It does not tell us if you're actively infected. So the way that you can look at it is this. And I will also say that the antigen testing analyzer that we use here in our facility, those results are recognized by every other state in this union as a confirmed positive test. Vermont is the one that doesn't. Vermont's not familiar with this process, so that's where there's been some recent question. The PCR test is the one that takes a few days to grow out. It's kind of like a culture. When somebody says we're going to send this for culture, it's because they're going to grow out whatever issue we have there. It's a little more sensitive. And then again, we won't touch on the antibody test right now. So the antigen test, if you think of it, I liken this to a soccer analogy. If you look at your antigen as your striker, right? So the antigen means virus or enemy, okay? So your striker is like the fastest moving little player. It moves fast and we want to control it fast. The antigen, the striker, if they make a goal, it's 100% it's a goal. If we have a positive, 100% it's a positive. There's no error. You make that goal, you make that goal. The PCR, same thing. If we have, the PCR is kind of like our halfback, okay? It's a little more is a little more specific. There's a little bit more stamina, but it's a little slower. But if your halfback makes a goal, it's 100%. There's no question. In our antibody test is your defense. And then we're the goalie. So the question has been recently, is our testing capacity accurate? Are we doing it accurately? Yes. There's no difference between our striker making the goal and our halfback making the goal. It's a goal. Where the difference lies is in the false negative. So our striker has a 12% chance of being missed. We miss it 12% of the time, so we have a false negative. If you have symptoms, I may miss you 12% if you get a negative. That's a false negative. Our halfback has a 6% chance of missing it. So that's why we confirm it with one that's a little bit more specific, but not necessarily more reliable. It just gives us we tighten up the miss rate. Where our antibodies come in, that's our defense. So when you've been exposed by the antigen and your striker and your halfback know that team, you're playing against a really competitive team. You know their plays, you know how they're going to play. The defense has been watching their plays and are ready. Like, we're ready to fight that. We're ready to play this game because we've watched how you play so that we can protect our goalie. And you can have decades of that kind of preseason training, if you will. So that's the majority of what most viruses, when we have a vaccination, that's like giving us preseason training. You have a vaccination, we're introducing this virus, this antigen, that gives us time, it gives our bodies time to get our defense ready. Those are the antibodies, is that we can mitigate. We need to stop active spread. You cannot do that if I have to wait 3 to 10 days to get a result back. Because most people think going home and being good means maybe just having a couple friends over. That's not enough. Right. We need to have total isolation. If we don't have people to spread this to, we don't have a pandemic. If I'm not spreading respiratory droplets to you, we don't have a pandemic. If I can pull you out of circulation really early, before you've had a chance while you're in your contagious phase to pass it to other people, let's stop that chain. But I can't wait 3 to 10 days.
Their advice was that people around the Northshire should double down on safety measures like wearing a good protective mask, social distancing, and avoiding unnecessary travel and possible exposures to others who may be carrying the virus and not know it. It's time to get back to the basics in order to defeat the COVID-19 virus, they said.
That if all the folks who came into Vermont around the 4th of July had been wearing masks and practicing social distancing and washing hands, etc., we probably wouldn't be seeing this outbreak today.
I'm not pinning it on out-of-staters, not even real closely. You know, it's not just out-of-state coming in. It's our own lax. It's the guidelines. People think, you know, they've been given the guidelines. When we opened up phase 1 in May, the numbers were, you know, it felt very decent and stable. But even then I was like, whoa, we are way too soon. Because folks that aren't in this day in and day out are listening, okay, what is it that I can do now? Oh, okay, so I can have 10 people? Okay, I'm gonna do 10 people. Because they're under the assumption, and rightly so, because that's what we've been telling people, is that, okay, 10 people, we're good with that. That's 10 people that I can infect.
Yeah.
So it's not just the out-of-staters. Yes, but traveling definitely makes it worse, but we have locals that are traveling.
Yeah, that's the thing. We have a lot of locals we have a lot of locals that travel now.
And people will say, but I've been doing so good. I only went to New Jersey for 4 days, and then I came back. Or I only went to dinner 3 times. Because that's what we're telling them is okay to do. From a medical, scientific, virology standpoint, it's not okay to do. We can still live our lives. We can still go to work. Our kids can still do school. But we can't pretend like there's no virus. We have to be smart. I do not want our economy to close down. I do not want our kids to not go to school. Our kids have to go to school. I have 4 of them. God help me, they need to go to school. But we can't do it blindly. We have to wear the seatbelt. You got to lock the doors. You got to do the things that we know are going to make us not get hurt and sick. It's actually not rocket science.
On Thursday, July 16th, there was another large crowd at the Riley Rink getting more tests, and hospital officials were anticipating that another 400 tests would probably be administered by the end of the day on Thursday. They were also planning to hold another day of testing on Friday, July 17th, at the Riley Rink as well. We'll be continuing to follow the story as events go along and follow up with more information as it becomes available. For the GNAT-TV News Project, I'm Andrew McKeever.